Welcome back to Let's Talk Autism with Shannon and Nancy. It's just Shannon and Dr. Darren Sush. Did I get the name right this time?
Perfect. Yeah,
okay, because I always want to say it wrong. And I was saying before, I said I'm having 3 mensches on the show today. So you're mensch number 3, because I always think of you as being one of the good guys. That you are such a wonderful resource and a wonderful addition to our community. I said before that you are, I want to get it right, a licensed clinical psychologist.
Yes.
But you are also a BCBA, but with a D at the end of it. He's Dr. Sush. So, and he is the co-author of this book, A Workbook of Ethical Case Scenarios and Applied Behavior Analysis. And his co-author is one of my other favorite people, Dr. Adele Nadowski, who I just love and adore. So now, I just want to stop for a second and say, when you told me what the title of your book was, there was a part of me that went, right.
Yeah.
And I think that's how most parents would go, okay, that has nothing to do with me.
Yeah.
But the truth is, it has everything to do with us, right?
Well, the truth of the matter is a lot of BCBAs, when they hear, okay, we're going to talk about ethics and behavior analysis, they have that same type of reaction too.
Oh, really? They don't get excited about it?
Well, because it could be a very boring topic if you let it, or if you let it become, how we provide our practice. That good ethical practice really means good clinical practice, and that it's really how we interact with the field on a daily basis. Then it becomes a lot more interesting, a lot more exciting.
There you go.
Because it's impactful in so many different ways.
Okay, and so we have to say, if you're watching and you are a BCBA or you're a caregiver or what, this is a wonderful workbook. And I just want to show that, they give you scenarios and then ask you to be mindful about what the ethical things are that are of concern within this scenario, and then sort of lead you through this discovery of honing in on what's important here, right?
Right.
So that's really what this workbook is about, to help you to be mindful about ethical things. So for the parents, though, that are watching, you might be thinking to yourself, again, I don't really care about that. I don't particularly want to know about it, but I'm just going to guess that 3 of the 5 problems that you're having right now are because you don't understand what the ethical guidelines are for the professionals that you're working with. So maybe we should go over some of that.
Sure. Yeah, and I think, behavior analysts and the field of behavior analysis has a code, an ethics code that we follow, similar to a lot of other fields. Like psychologists will have an ethics code, medical practitioners will have an ethics code, counselors will have one. And there's a lot of similarities between all those codes. And what that is, it's a way in which we guide our practice to ensure that we as providers are doing the best possible job for the individuals and the families that we're working with. It also helps us to make sure that we're protecting ourselves, that we don't get into any type of trouble, whether it be giving ourselves a bad name or get into any situations that might potentially be problematic, and also kind of make sure we're representing the field in the way that the field would want to be represented, so that you don't, as a family or a parent, go and have an experience with a behavior analyst or a BCBA, and then maybe it doesn't go so well, but then you attribute that to the entire field and unfortunately don't seek any additional services that might be appropriate or necessary.
Fair enough. So, but I can tell you, I always like to tell on myself, when we started therapy, the first therapist who came to our door, who ended up being, our sort of senior therapist, is a gentleman who I still to this day adore the ground that he walks on. I always say, if he ever needs a kidney, he just needs to pick which side he wants. I mean, this is how much I love this man. And he came in and was a miracle worker with my child, and I immediately was like, I want to be best friends with him.
Right.
And I think that we all feel that way, right? To the point where 5 weeks after we started therapy, I had an opportunity to go on a game show, and they were saying to me, we want you to come in with another person. And I asked him, I said, will you go on this game show with me? And I thought that was reasonable and rational, because I thought it made a great story. Like, he's the therapist for my son. He's getting ABA therapy, and he's teaching my son to be able to talk again. Who wouldn't want to see that on television?
Right.
And of course, he was like, I'm so very sorry, I won't be able to do that. And my question was, why? And I always say this to parents, because a lot of times parents will feel we feel stupid once we understand what the rules are, right? And I always tell myself to go, no, I'm the winner of like the worst choice that a parent could make by asking him to go on a game show. But they can't do that. They can't go on a game show with us. And let's talk about some of the reasons why.
Yeah, and the thing is that behavior analysts, BCBAs, BCBA-Ds, and as well as the direct staff members, the registered behavior technicians, we all should know about the code, and we all have an obligation to follow the code, again, for the best of the individuals that we're working with. So it is our responsibility. But it is really important, I think, for us as practitioners to talk about that with families, to talk that there is this code that exists, what some of the stipulations are, what some of the guidelines are within the ethics code, and then why it's there really for the benefit of them. Because otherwise you might find yourselves in those situations where there's that miscommunication or misunderstanding, and also so families know, oh, this is what I should expect out of the person coming in and working with my child or with my family. Yeah. This is something that helps to maintain a standard for the betterment of the care that we're receiving, for the betterment of the instruction and intervention. And
that really is the bottom line, is that not only is it what's best for the therapist, but it's what's best for the kiddo, for the client, is that we maintain a professional relationship.
Right.
And I go directly to anybody who watched Parenthood, right? And on Parenthood, there was a young man who was diagnosed on the spectrum, and they bring in the therapist, and the therapist starts working with him, and things are going well, and they're making progress and whatever, and then she begins to date the brother.
Yeah.
And it doesn't work out, and everybody's like, oh, they're keeping it secret, but it doesn't work out. And then suddenly the therapist, and this is a fictionalized story, but we can learn a lot from it. The therapist is standing at the door saying to the mom, I'm sorry, I'm not going to be able to come back to your house anymore. And the mom is devastated, saying, why? And she's like, well, I feel uncomfortable being around him. And the kid loses therapy. It pains me, and believe me, you guys, I know watching, it's like we want to be able to have these people in our lives. We want to be friends with them on Facebook. We want them to come to family dinners.
Right.
I want them at Thanksgiving at my house because they're with my kiddo all the time. But we can't. There are rules.
Right.
And they are for the betterment of our kid.
Right, and that's why I think even just having that conversation, having that dialogue with families and the treatment providers about what the expectations are, but then also what those expectations mean in relation to that particular family. Because just because there's that rule that's there and it should be followed, that doesn't mean you can't at least have a conversation to understand it a little bit more. Sure. And I think that's where you can come to an agreement, improve that therapeutic relationship, and also make sure that, again, we're all providing the best care for that individual. Because our task and our responsibility when we're working as a behavior analyst is to advocate to do the best job for that person who maybe is not able to advocate for themselves.
That's right. So let's go over what some of the rules are.
Sure.
We won't have time to go over all of them,
yeah.
but what are some of the expectations that parents should have about, because sometimes the therapy is happening in your home, sometimes it's happening out in the community, sometimes it's happening at school, sometimes it's happening at a center. What are our expectations of how we interact with these people and what we can expect and what's permissible?
Right, and one of the things that we try to do, and I think most behavior analysts would try to do, is at the start of that clinical relationship, at the start of that therapeutic relationship, go over as best as they can what the expectations are. Okay. So, which means what the expectations are of me as the service provider, meaning here's the work that I do, here's the services that I provide, here's the foundations of behavior analysis and why I work within behavior analysis. If you have questions, how to approach those, where services can and can't be provided, and then also maybe what the expectations are of the family. So one of the things that often comes up, especially because I think the work that we do is a little bit unique, is that oftentimes we do go into the home and we're in these private areas and we're running through the bedrooms and we're going in bathrooms and things like that. That it is important to at least acknowledge that there could be a loosening of that boundary if you don't at least respect each other and have a discussion of how you're going to maintain it, again, for the betterment of the individual.
So, but so it's not one size fits all. There should be a discussion with the provider about that. But what are some guidelines for parents that, I mean, one of the things that parents will say to me all the time, I don't understand why the therapist can't eat with us.
Yeah.
So maybe go over what that rule is.
Yeah, so there is, and that is probably the biggest one that gets talked about is the gifts clause, if you want to call it that.
And so food is considered a gift.
Food, well, depends, right? So it depends, and that aspect has been added to the newest version of the ethics code, which was written in 2014, became official in 2016, but it says right in there, we don't give gifts, we don't accept gifts. And it's pretty blatant how it's described at all. And the controversy there is not one-sided. Every time I'm talking about ethics, every class that I teach about ethics, the first question that gets asked, if they have a question about the code, is what about the gifts thing? Because it's a really sticky situation, because not only do a lot of other fields accept gifts.
Teachers accept gifts.
Oh yeah. And a lot of other professions, teachers accept it. It's sometimes standard, and from a cultural perspective, it's sometimes really important as a means of demonstrating appreciation.
Yeah.
And there's not necessarily the black and white rule related to it. Of course, some gifts are probably better than others, or if they're saying, oh, and I got you this $100 gift card, probably a pretty clean standard. That's not necessarily appropriate, but it wouldn't really be appropriate either for the BCBA, who's then being offered this gift card, to say, how dare you do this?
Right.
Don't put me in this position.
Exactly.
You should know better, because, well, a lot of families don't know better, and they're trying to do something nice and show appreciation for the work that you're doing. So even if you're not going to accept it, the way in which you communicate that can be really different. There's been a lot of talk, though, about what about a card or a picture or something kind of small but meaningful.
Yes.
And I think
like a child's art project.
Yeah, by no means am I saying if a kid draws me a picture of me and him playing, I'm not going to say to that kid, but no way, I'm sorry, I cannot accept gifts. So that's something that's, of course, I think allowable, and I don't think that there'll be any argument. Of course, I don't work for the BACB, but I think I could speak fairly comfortable to say that. But I think one thing that would then be our responsibility to keep in mind as you get maybe to the higher, moving a little bit up from that child's art project, is how might this, maybe not necessarily in this moment, but in the future, would this have any repercussions to my ability to make sure that I continue to provide the best of care for you and your family?
Right. And the truth of the matter is that we can't think of every contingency, and that as something as innocuous as saying we're sitting down and eating. I mean, I remember there were times when a therapist was there when we were sitting down to eat because we were working on a food thing with my son. And to me, it was awkward to have them sit at the table and not have a plate in front of them and have something to eat.
Right.
And they were so professional about it. They would say, oh, thank you, I just ate before I got here. And all this, and I would be like, they don't like my food, right? Because that's what we do as parents. And I didn't completely understand it, even though, can I tell you how many times it was explained to me?
Right.
But I have a pin that somebody gave me that is very indicative of me and my life, that I was like, your silly rules don't apply to me, right? That's what my pin, and they were like, this fits Shannon. Because I was like, that's a silly rule. If I don't understand it and understand how it impacts me, often I'm a little dismissive of it.
Right.
And it seemed like, how, if you sit and have some mashed potatoes with this, how is it going to impact, my child negatively? I think it impacts him negatively to not see you eating. He doesn't see you as a person. So, for me, I'm never 100% sure.
And that is, I think, where, as the behavior analyst, the person working within your home, or the one-to-one, the RBT, maybe working within the home, it'd be a great chance to talk to the supervisor about how to manage that circumstance and situation, because in one respect, yes, the code does say this would not be what you're supposed to do, but then what might be the repercussions of that choice of saying no? What might be the repercussions of saying yes? And then you have to kind of weigh the costs and benefits of that, because if that's something that's going to completely tear apart the clinical relationship, you're not going to be effective anymore. Maybe there's something that can be discussed with the family. But again, if you just say, no, I'm not going to eat your food, yeah, who's not going to get offended by that?
Right.
But if you explain and you have that conversation about where you're potentially coming from, then maybe there's something that can be worked out. If it's accepting the food, maybe, or bringing your own food, or something, anywhere in between, it might be an option.
But we as parents need to be aware of the fact that there are ethics that they need to follow, and that their job performance relies on them doing that. The bigger thing is making sure that we don't create an environment in which anything that can happen that can get in the way of the therapy, and it can. It absolutely can.
Yeah.
I'm sure that every parent watching is like, oh, I've seen that happen, right? Yeah. And it seems all innocent and whatever, but why should there be ever anything that prevents your child from getting the therapy that they need?
Right, and the reality is in most circumstances, it's not going to lead down the road to something really bad or horrible. It's not going to have this type of problematic impact on the relationship, or really make sure that, I can't provide services for this family anymore. But it would be appropriate for the behavior analyst to at least think consciously about that, to make sure, because again, our role is to provide scientifically validated treatment, the best of treatment, and to do whatever we can. And if we're making decisions that are contrary to the ethics code, then maybe we're compromising that.
Yeah, there we go. And I love that you're looking at it from that end. Of course, I'm always going to look at it from the parent end. And one of the things that I say to parents often when I'm trying to explain this to them, because it's hard, right? One of the things I say is, let's stop for a second. Let's imagine that your child grows up and they're 19 years old, and 20 years old, they're in college, and now they have a job. And their job requires them to go into people's homes that you don't know. What are you comfortable with? What are you comfortable with? Are you comfortable with them having to eat with whatever that person is providing them? Because when you put it that way, I go, wait a second, no. I don't want my child to feel like they have to eat something. It would be better if there's just a rule that they don't eat anything.
It makes it a lot easier.
It does, because it's like, because if you eat some and you don't from somebody else's house and somebody finds out, then it's, oh, you really don't like my food. And when we look at it that way, and the minute I think that, because sometimes parents will be like, well, I don't understand why this therapist can't go, meet me on the moon to do therapy, right? Like very inconvenient. And I'm like, all right, let's take it back. If it's your child and it's their job, does this seem reasonable to you? And then it changes everything. Changes everything. So if you can look at it through that light, you guys. There's no reason why a parent can't get this and have an opportunity to look at some of the case studies and see some of the issues that you guys have to deal with. I just thumbed through it and I was like, oh yeah, no, I see that. And I love that there is an element of mindfulness about this.
Sure.
I know that both you and Dr. Nadowski are mindful people. So I love that you're calling it into the open and have people look on it and work on it and understand a situation before it happens.
Yeah, there's no way to prepare for everything, but having a good understanding of how to either ideally prevent some of these ethical challenges from coming up, or at least manage them should they become present. That's really what the workbook is about, is just getting used to being able to deal with these situations and circumstances in the best of ways.
And I would imagine you guys have seen a lot in both of your practices.
Oh yeah.
Because there's a lot of things that wouldn't occur to me as a parent. And then, over the years, I've heard a lot of things from parents and I'm like, oh, see, now that would never have even occurred to me. So where can we get the book? And again, it's called A Workbook of Ethical Case Scenarios and Applied Behavior Analysis. And it's not a snooze, let me just say. I thought it would be, but it's not. So where can we get it?
So it's available through the publisher, which is Elsevier, or on Amazon they have it, and then most other kind of online bookstores.
Wonderful. And I hope that we are a little bit more mindful of what you guys have to go through, because it's not easy.
Yeah.
It's not easy to have to look. I'm an autism parent, and I'm a handful. I'm not easy, right? So imagine, I try to think to myself about if I had 10 of me that I had to deal with, or 20 of me that I had to deal with, what that would be like. And we're not even talking about the kiddos, we're just talking about the parents. And we have concerns and needs, and to be able to deal with that in an ethical background with that construct is what I'm trying to say. All right. I thank you so much
Thank
for
you.
being here.
Yeah, thank you very much for having me.
We are totally out of time and past time, and I'm supposed to tell people who's on the show next week. It's here. I can never find it. Okay, so next week on the show, we have Amanda Kelly is going to be with us on the show. So that's going to be super fun. And then on Tuesday, we have a best of. On Wednesday, Dr. Doreen Grampiche will be here with us answering your questions. On Thursday is a very special show because it is Halloween. I will be in costume on Thursday, and our very special guests for the hour will be Matt Asner and Nava Paskowitz Asner on Thursday, and you will want to watch that. There will be surprises, and you will want to see, because I have my costume, and you will want to see. And then on Friday, we had Jill Woodworth, who is the host of TSC Talks, a podcast about tuberous sclerosis complex, which I'm hearing there are many more cases in the autism community than I was aware of, and so we're going to hear all about that on Friday. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.